Good morning, Board. Thank you for your service to the physicians of Texas and to their patients. I'm Dr. Ingrid Skop, a board-certified obstetrician gynecologist from San Antonio, where I've been practicing for 30 years. In the wake of the Dobbs decision overturning Roe v. Wade and allowing Texas to implement the Human Life Protection Act, my practice has not changed. Although, like approximately 90% of obstetricians, I do not perform elective abortions, I have always been willing to intervene when a severe pregnancy complication has posed a risk to my patient's life. I understand this law, and I would continue to offer the same intervention to my patients today. Unfortunately, I cannot say the same for my peers. There is abundant documentation that physicians are confused and frightened. In many cases, they have not offered timely intervention. It has resulted in harm to women, including some unfortunate women in this room. These doctors are frightened. They feel that they are making decisions in a vacuum, and that if they make the wrong decision, they can lose their medical license, they could go to jail, and they could incur severe financial penalties. So I applaud you for taking this opportunity to provide guidance, much needed guidance in Texas today. I think what Dr. Zafran has read is a very, very good start, but there are a few other things that we need to be emphasizing. It's been discussed that reasonable medical judgment means what a reasonable practitioner, understanding the details of the case, the actions that they would perform. This is the standard of care. Doctors need to be reassured that they can continue to provide the standard of care in taking care of their patients. It is critical that it be emphasized to physicians that it does not need to be an immediate risk to a woman's life. We know what conditions can cause a risk to a woman's life, but we need to be reassured that we can intervene at the time the diagnosis is made. We do not need to be waiting until a woman is dying. And in fact, it was mentioned the Texas Supreme Court's discussion in the Cox case. They also affirmed immediacy is not required and a woman does not need to be dying. Doctors need to know that. Prior to the confusion, every hospital that I have worked at has had a therapeutic abortion protocol. I assume most hospitals still do. In addition, I would like for you to recommend to the hospitals they update their protocols and they make them known to the physicians so physicians know how to document when they decide to perform an intervention. That way they will feel that they are not making decisions alone, that they have the support of their medical organizations and the support of their hospitals. And I think that will result in much better quality care to the women of Texas. Thank you.
Thank you. But before you leave, I just want to ask, you're a physician, obviously, and I think you brought up a very important point that I just want to highlight. I think physicians make good medical judgment, and I have heard anecdotal incidents where what a physician thought was the right choice to make may have been superseded by what a hospital was concerned about. And obviously, we don't regulate hospitals, but there is a ban on the corporate practice of medicine in the state of Texas. And it's physicians who practice medicine, not hospitals. So I think not necessarily within this rule, but ideas, whether it's for an FAQ or something along those lines, to help reinforce that idea. I mean, we can do that because unless we know that there's a situation like that where a hospital, whether it's their legal department or whatever it might be, is superseding what a physician judgment is, it is important for this board to hear that. Because from our standpoint, that's practicing medicine without a license. So again, I just want to highlight that we've heard anecdotal examples of that happening. Maybe it was a little bit earlier on when the law was passed, hopefully a little bit less now. But again, all these rules and the Supreme Court ruling talk about about physician judgment. It doesn't talk about other practitioners or entities, facilities, or what it might be as far as them making that judgment. So,
yes, sir. What you've described is happening. I've seen it as well. And again, I just think doctors need to know that they're supported, because they feel like they're alone making these decisions. And that's why we're seeing so much confusion and sometimes bad decision making.
Thank you.
Thank you.
Doctor, one more comment. I'm Dr. Quinones.
Yes, sir.
And I wanted to thank you for taking the time and the courage and your candor and your presentation. I also wanted to comment on something that you said, and that was the idea of reasonable medical judgment. It's a rule that governs our lives as physicians every single day, every single decision we make, every single patient we see. It's not a new concept. It's not a novel concept, and it doesn't change for this particular purpose. I think that going forward, this board feels very strongly that physicians in Texas need to know that they have the support of the board as long as they follow the rules and use reasonable medical judgment and document. So thank you very much for bringing that point.
Yes, I agree. And I absolutely agree with your decision not to make a list. What we can do is we can look at ACOG's practice bulletins, and in many cases, they tell us the situations that are going to pose a risk. And if there's not specific guidance, every hospital has a quality committee that can convene and can give doctors support in making these decisions.
Dr. Badia.
Dr. Blatcher?
Oh, thank you. Appreciate it. Thank you for your time.
Okay, thank you.